Hey, welcome back to Zappkit. I'm Shira, and today we're going to tackle the number one question we get from new users. Where do I put my electrodes? So, if you've got your electrodes in hand and you're thinking, now what? Don't even worry because you're in the right place. I'm going to walk you through the basics step by step, so by the end of this, you'll know exactly how to get started without second guessing yourself. All right, let's demystify what's really going on here. A lot of people think the electrode itself is the focal point, but it actually isn't. What's happening is the frequencies are taking a zipline ride from one electrode to the next. So the space between them is where the magic is happening. That means you don't have to get it perfect. Why? Because frequencies don't hit a pinpoint. They flow through your body's natural pathways. As long as your target area is somewhere in between the electrodes, your body can take it from there. So think of it like you're making a little frequency sandwich. One electrode on one side, the other on the opposite side of your target area. That might be left and right, like both sides of your waist, or front and back, like one on your belly and one on your lower back. The exact millimeter doesn't matter. What matters is the pathway you're creating through your body. But, Shira, what if my target area isn't obvious? I'm so glad you asked because that's okay too. In those moments, go with the full body placement. That's one electrode on your shoulder, the other on the opposite hip. This diagonal pathway moves through your whole system and is a simple, reliable choice whenever you're unsure. A few quick reminders before we move on. You'll want to avoid bony areas like your knees and elbows because frequencies don't pass well through bone. Also, we don't recommend putting them on sensitive areas like your neck, face, spine, or groin. Trust me, that is not going to be a fun experience. All right, you've mastered the foundation. Electrodes create a pathway, and you don't need to be perfect. From here, it's all about choosing where you want that pathway to run. So, in this section, I'm going to take you through a quick tour of your body from head to toe, and we're going to look at a few of the most common ways to place your electrodes depending on which system you'd like to support, starting from the top. But Shira, you already mentioned we should never put electrodes directly on our face, neck, spine, or head. What if I want to work with my sinuses or my throat, my ears, or I just want overall brain support? In that case, place the electrodes over the tops of your shoulders. Since each electrode covers an area about the size of a basketball, putting them on your shoulders is more than enough to reach those sensitive areas. When supporting your upper body systems, things like breathing, circulation, and your upper lymph nodes, place one electrode on your chest and the other on the opposite mid-back. Moving further down into digestion, place one electrode over your liver. That's just under your right breast or along your upper rib. And the other one goes on your left lower back. That creates a pathway right through your digestive tract. For your nervous system, head to your waist. Place the electrodes on each side lined up with your belly button. This connects with both the vagus and sacral nerves, which help calm and balance your whole body. Now, let's talk about your joints. Anytime you're supporting your knees, elbows, hips, or shoulders, place the electrodes on opposite sides of the joint. Remember what we said earlier about avoiding placements directly on bone? Always choose soft muscle areas. From there, we move into the reproductive and lower systems. We're talking your bladder, lower lymphatic system, and everything in the groin area. Place one electrode between your belly button and hip, and the other on the opposite buttock. This creates a pathway right through the pelvic region. And finally, grounding. If you want to reset from the ground up, place the electrodes on the soles of your feet. This connects into reflex points and helps with circulation and overall balance. If you're new to the idea of grounding, think of it like plugging yourself back into the Earth's outlet. It's a way of rebalancing and recentering your whole system, starting at your foundation. So, from shoulders to chest, stomach, waist, joints, reproductive systems, and down to your feet. you've got a full body roadmap that makes placement simple and effective. What should I be feeling during my frequency therapy sessions? Most people feel a mild tingling or pulsing when the frequencies are lower. Frequencies under about 1,000 hertz are usually the easiest to notice because your nerves can still pick up on the vibrations. As the numbers climb higher, your nerves aren't able to detect them as well. Once you get above about 1,500 hertz, it's almost impossible for the body to sense them, and that's totally normal. The green light on your Zappkit is your confirmation that everything is working, even if you don't feel it. How do I know if my electrodes are making good contact? Good contact usually means the electrodes are lying flat and sticking well to clean, dry skin. You shouldn't feel sharp stinging or uneven sensation. If one feels weaker, press down gently on the electrode or check the cord connection to make sure it's snug. What if the electrodes don't stick well anymore? Can I clean them or do I need replacements? If they've just picked up a little dust, you can rinse the gel side lightly with lukewarm water and a tiny drop of mild soap. Then let them air dry. But if they've lost their stickiness, they feel dry, or are starting to peel, it's time to replace them. Most last about 2 to 3 months with regular use. My sessions feel uncomfortable. What should I do? First, turn down the intensity using the knob on your Zappkit. If that doesn't help, try moving the electrodes slightly to a softer, fleshier spot. And if you ever feel pain, rashes, or irritation, stop the session and contact your healthcare provider. That's uncommon, and it usually means something else is going on that needs attention. I have a less obvious issue, like my skin or general inflammation, fatigue, etc. Where do I place electrodes for things like that? If you're dealing with something less obvious, like skin flare-ups, general inflammation, or just feeling wiped out, don't worry. You're not missing a secret placement chart. For those kinds of things, it's less about a single spot and more about supporting the bigger systems underneath, like your circulation or digestion. So bottom line, if you're scratching your head, keep it simple and don't overthink it. And if you still aren't sure, you can always send us a DM or an email, and we'll walk you through your questions the best we can. Which leads me to the super not fun reminder we always have to say. I know it's tedious to hear every single time, but it is important to understand that we at Zappkit are not doctors or certified medical professionals in any way. The Zappkit, which includes the Zap, are wellness tools, not medical devices. They're not intended to diagnose, treat, cure, or prevent any disease. If you have a medical condition or concerns about your health, or if anything feels off during a session, always check in with your healthcare provider. You will see some guidelines here on the screen. We invite you to take a moment and look those over before you start your first session. And there you have your electrode placement crash course. Keep it simple, keep it safe, and keep it fun. And remember, don't stress, don't overthink it, because you've got this. Until next time, stay curious, stay well, and happy zapping.